Hi, I am Dr.Moumita, general physician. If the BP is more than 180 systolic and diastolic more than 120, it is an emergency. Second thing, if your BP is somewhere near to 160 or to 180 and diastolic more than 100 to 120, but you are having something like vision changes, something like abnormal faces, headache, vomiting, chest pain, or urine is not coming much more, legs are swelled, cough, breathlessness, those are emergency signs. You have to rush to hospital, but don't delay till that period. Check your BP earlier. Okay. Now when we come to a blood pressure, somebody who is having below 140 or 140 to 150 borderline, as somebody is having 80 to 90 or just above 90, we will check the BP for them. We will check in the both arms, at least on the first time when you are visiting to a clinic or a hospital. We'll check it between 5 to 10 minutes of gap. We'll average it and we will ask you to check for at least 2 weeks and see how much is the BP is coming. Or else what we will do is home monitoring. We can monitor it for 24 to 48 hours at home and we'll see how the BP is coming. Okay, like prolonged monitoring of the BP we can do. Now if you are somebody who is just hypertension, just borderline, few things that you can control is one thing, your sleep, that has an immense role in blood pressure control. Okay, second thing is your diet. Reduce the salt to 2 gram, less than 2 gram. Now it is very difficult how to measure less than 2 gram. Just don't take any salt above and try to reduce the salt whenever you are taking. Avoid packed food like chips, bakery items and all those things. All packed food. Avoid cokes and all the canned beverages and all. We just try to avoid those things. Then what we have to take? There is something called DASH. Dietary approach to stop hypertension. So what is DASH diet? Increase your fruit content. So fruit will have more potassium, more magnesium, which will help for your blood pressure control. Okay, reduce salt intake. Whenever you are reducing your salt intake, obviously BP will come down. Third thing, increase fiber. So fiber will have more of antioxidant and fiber will reduce, it will have a low glycemic index and it will help for your metabolic syndrome also. Okay, third thing is try to reduce your all fat things below. Okay, so anything, if you can take milk, that should be low fat milk. Okay, other than that, all the fat thing, oil and high fat milk and all this thing, try to keep it low. You can increase seeds and nuts also, that will also have omega-3 fatty acid and good fats. Okay, so these are the few things that we will go for the diet. Sleep is important. Avoid smoking or alcohol if you're doing that. Okay, now you will take that how much alcohol is it permitted and all. No alcohol is permitted, no smoking is permitted. So please avoid smoking, please avoid alcohol. Okay, so these are the few things that you have to do. Last thing, which is very important, weight reduction. Weight reduction does not mean you have to reduce your muscle. Fat reduction. So we will have to start walking. To start walking at least 30 to 50 minutes per day. So total of 150 minutes in a week we can take it. And if you are doing a mild to moderate, if you are doing a very high intensity exercise, 75 minutes per week should be fine. Okay, so no need to remember all this thing. Just walk for 30 minutes daily. Just make it a routine. Walk for 30 minutes daily. That should be fine. So we are doing exercise. We are reducing our salt intake, our sleep is good, we are taking a good food and we are de-stressing ourselves. Meditation. So meditation will increase our parasympathetic and sympathetic regulation in our body. So meditation will calm down our nervous system. There are some causes which will increase our sympathetic tone and cause hypertension. So that will come down when we do meditation. Many people will say, or something meditation, if you do that our BP will come down. Yes, that is correct. So meditation practicing is also good. So these are the few things that we can do is without any medication. But yes, once your BP is very high and that has an impact with other organ, like you have a problem with your heart or a kidney or your eyes, then definitely we have to start you with the medication. Or if your BP is very high, we have to start you with meditation. If we don't take medicines, no doctor, I don't have any symptoms, even if my BP is 160, 170, I am not going to take any medicines. What will happen? What wrong can happen? What happened is, whenever our heart is pumping, in each of our body tissue should get oxygen for its work. Same, heart has to pump every time. Whenever it is pumping, each of every heart muscles need oxygen. How it will get? It will get from heart blood vessels only. But because of high BP, the blood vessels will become thickened. So it will give less blood supply to the same heart muscles. So what will happen? The heart muscle will be lack of oxygen and it will start getting destroyed and dying. That is called heart pain or angina. So that is the first signs of your heart attack. So if we are not taking, so whenever we are doing little more exhaustion, like you're climbing steps or you're running or you're doing any heavy exercises, or just after taking bath or so, you may feel some chest pain which came, and it relaxes when you calm down, because your heartbeat is coming down, your heart demand is coming down. Now, if that stage also, if you don't diagnose it, slowly it will go for infarction or heart attack. Okay. Now, even still, if you don't check yourself, sometime it can cause heart failure. Heart is unable to pump blood, so it can't go to all over the other major organs. So what can happen? It can happen, multiple organs can fail. Okay. Same thing, whenever the BP is very high, there can be burst of small blood vessels in the eye or in the brain that can cause stroke, paralysis, okay, even sometimes death. Sometimes even it can cause encephalopathy. Your brain, because of very high BP, we don't know what is happening to you. You'll be having continuously vomiting, you'll have headache. So encephalopathy stage, you don't know what is going on in the surroundings. Sometimes it can impact on your kidneys also. Very high BP for a long time impacts on our kidney. Okay, so these are the few things that can happen if you are not taking care of your blood pressure seriously. Okay, so this is, blood pressure is very easy to diagnose. You can diagnose at home by yourself. Easy to treat. Start at least the basic thing. Okay, and when it is crossing, come to a doctor who can check or who can start the medication. Okay, so you can prevent the complication. Okay, so the further going on, BP very easy to diagnose, very easy to control it. So let us control together blood pressure. Thank you.